Hi, my name is Rosa Salas. I am going to be your student nurse practitioner for today. I'm going to do a head to toe physical exam, okay? Um, what's your name? Hello. Okay, and how are you today? Good, and yourself? Thank you for asking. So, looking at your appearance and your face and your body, you do not seem like you're in any distress or discomfort. Okay, I'm looking at your hygiene. Um, from top to bottom is well kept. I'm looking at your emotional affect, which is normal and appropriate for the situation. Okay, and so I'm also looking for I'm going to tell you your vital signs, which I took earlier today. Um, Vital signs: your apical pulse was 85, your respiratory rate was 16, and your blood pressure is 110/70, which are all normal readings for your age group. Okay. Um, So now I'm going to do, won't be measuring your head circumference. That's a measurement that we do for pediatric patients 3 years and younger, okay? So now I'm going looking at your nutritional development. You're well nourished and well developed, which is normal. You're healthy. Okay, so I'm doing your development, your dental developmental. I'm letting you know now that you're going to continue to lose teeth and gain permanent teeth. When you reach adulthood, you should have 32 permanent teeth. Okay. Um, um, your pubertal development is Tanner stage 2. Okay. So now I'm gonna move on to the developmental part of this exam. So you're currently on industry and inferiority stages of Erik Erikson's theory and form operations of Piaget's theory. Okay, and you are achieving your milestones. You are developing social, physical, and learning skills. Okay, and I know that you're going back to school soon, correct? Yes. Okay, and you're going to seventh grade. Yes. Okay, are you eager to go back to school? Yeah. And why are you eager to go back to school? Mostly because of my friends. Okay. Hope you have a good time. Okay. Um, Okay, so your language skills are receptive and expressive. Okay, and I won't be assessing the Denver developmental tool because that's for pediatric patients 2 years and younger. Okay, and that test just examines for it helps us identify any slow development in that age group of patients. Okay, so moving on to your skin, I'm assessing your skin from head to toe, and your skin pigmentation is normal for ethnicity and it's normal pigmentation throughout. Okay, I'm also looking for any lesions and scars in your skin. I don't see any. And now I'm going to just touch for the texture of your skin. Smooth, okay, throughout. Now the temperature of your skin, warm and dry throughout. Okay, I'm gonna assess skin trigger. It's gonna pinch you lightly. If it hurts, let me know so I can stop. Okay. So this is checking for hydration, which is normal. When I gently pinched you, the skin retracted to its normal position, okay? That means you're well hydrated. I didn't see any pinching, which is an abnormal finding. When I pinched your skin lightly, if it would stay in a triangle or tent-like appearance, that would mean you're dehydrated, but you're not, okay? Okay, so moving on to our head, your scalp, your hair. You're looking at the shape and contour of your head is normal cephalic, which is normal. I will not be checking your fontanelles because those are bones in your skull that we check for patients that are 2 years and younger, and we're assessing for the closure of those skull bones. Okay, so we're not doing that because at your age, which you're 12 years old, those are already closed. Okay. Also, I'm checking that there's no lateral thing of your lateral eyebrows, which they're good. I didn't know there's no notations of that. Okay, so I'm looking at for now I'm going um, and that's our for your now I'm checking your scalp for any lesions, any nodules. Okay, I'm just gonna run my fingers through your hair. Okay, and feel. Okay, there's no nodules. No, do you have any tenderness? No. Okay. Now I'm going to uh, describe the texture of your hair. It's soft. It's your evenly distributed. So now I'm gonna check your hair for any lice infestations, okay? Which is really important if you're going back to school, okay? I'm gonna walk around this side. Okay. Okay, so there's no lice infestations, okay? So now I'm gonna move on to our um, eye exam. And throughout this exam, I will be examining your cranial nerves, and I will let you know when I'm doing so, okay? Um, so for your eyes, I'm looking at your eyelids for any ptosis, lesions, or crusting. I don't see any. Ptosis just means dripping of the eyelids, okay? All right, so now I'm gonna check your conjunctiva. So can you look up for me, please? Up, brow is pink and moist. Can you look down for me? Bow brow is pale with some injection, which is normal. Injection just means redness, okay? So now I'm looking at your sclera, which is the white of your eye. I'm looking for any yellowish tint to your eye color, and you don't have any. It's white and clear. Um, I'm looking for any hemorrhage. There's no hemorrhage. That just means bleeding. So no icterus and no hemorrhage bilaterally. That means both eyes, okay? And you're gonna hear me say that word throughout this physical exam. This means on both sides, okay? So now I'm gonna check your cornea. I'm gonna check for scarring or any lesions, and for any arcus, which is a ring around your cornea, and you don't have that, okay? So with this pen light, I'm just gonna look on the side of your corneas for any scarring, okay? Look to the front. Okay, no scarring. Okay, no scarring. Okay, so now I'm going to look at your iris, which is the color of your eyes. I'm looking for uniformity of color throughout your iris, which you do. They're both brown in color throughout your iris, okay? So now I'm going to be assessing your pupils with this pupil gauge. And you see how it has a size? Okay, so, and I'm also checking for that your pupils are both round, regular, okay? And okay, so they are. Now I'm just gonna look and measure. Look straight ahead at me, please. I'll measure your pupils. Okay, they're a size 4. So both pupils are round, regular, and equal, and they're a size 4 millimeters, which is normal. Okay. Now I'm going to assess your cranial nerve number 3, which is your oculomotor. I'm going to do that with your pupillary response to direct light and consensual light and accommodation. Okay. So the first test, I'm going to shine this light on your left eye, and your pupil should constrict, which means shrink. I'll be doing the same thing with your right eye, okay? So I'll explain the other two as I go along, okay? Just look straight ahead. Okay? Straight ahead, please. Okay? So they both constricted, okay? So now for pupillary response to a that was direct reaction. Now for essential lighting, what I'm gonna do is I'm going to shine the light on your left eye and your right eye should constrict, okay? But I'm gonna block the light, okay? Okay, constricted. On your right eye, constricted. Okay, so we passed that test. Now I'm gonna do accommodation. Okay, so I'm gonna grab my pen. I want you to look at the top of this pen and look straight ahead to the far wall. Okay, and your eyes should accommodate. Your pupils should constrict when you look at the pen, and they should dilate, grow bigger when you look at the far wall. Can you look at the pen for me? Can you look at the far wall? The pen again, and the far wall again, please. Okay, so your eyes they constrict when you focused on the pen, and they dilated when you focused on the wall. Okay. Now I'm gonna check again your cranial nerve number 3, 4, and 6, which is your oculomotor, tricular, and your abducens. And I'm gonna do that with checking your extraocular movement. Okay. So what I want you to do is follow my finger, just with your eyesight, not with your head. Okay. And what I'm doing is I'm looking for nystagmus, which is rapid movement of your eyes. Okay. Okay, no nystagmus noted. So the the cover eye test, assesses for strabismus, which is crossed eyes. I will not be assessing because that's for pediatric patients 7 years and younger, okay? But with this one, I would cover, if you were in that age group, I will cover your right eye and check for any eye movements on your left. And then I'll cover your left eye and check any movements on your right eye, okay? The eye that's not covered. Okay, so now I'm going to do cranial nerve number 2, your optic nerve. I'm going to assess this with your visual acuity, with the static wiggle test, and I'm going to with the uh, Snelling chart. I'm sorry, the visual field with your wiggle static test, and your visual acuity with the Snelling chart. Okay, so I'm going to do the Snelling chart first because I couldn't find a smaller one. So in a real world scenario, this would be 20 feet away. But because the room is small, I couldn't find one. We're going to pretend that this is 20 feet away from you, and you're going to read the smallest line that you can possibly read from left to right. Can you do that for me? Covering your right eye, please. E-E-F-P-O-T-E-C. Okay, good job. Can you cover your other eye, please? E-E-F-P-O-T-E-C. Okay, now can you read it with the same line with your both eyes open? E-E-F-P-O-T-E-C. Okay, so you have 20/20 vision. Now, for your visual fields, the wiggle static test that I mentioned, I'm going to place my hands 2 feet apart and to the side of you, okay? So let me know when you can see my hands coming into your view, okay? Ready? Start it. Now, 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 now. Okay, so that's cranial nerve number 2, your optic nerve, and you passed that test, okay? So now what I'm going to do is I'm going to check, I'm going to check your inner structures of your eye. I'm gonna check for the red reflex, and I'm checking for the optic disc. Okay, I'm gonna grab my ophthalmoscope. Okay. Okay. So this is just, you can feel for it. There's no sharp objects, nothing coming out of it, nothing will come out of it. Okay. And there's a light. You see your hand? A beam of light. That's all that's coming out of it. Okay. So what I'm gonna do is I'm gonna check for your red reflex. Okay, I'm gonna get extremely close to you, about 10 to 15 inches away. You know you're uncomfortable, so we can stop. Okay. With my right hand, holding the thumbscrew with my right hand, I'm gonna check your right eye. Okay. 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 So I see the orange glow. The light reflects from my thumbscrew, which is red reflex is intact. I see the moving um, nasally towards the retina. I see the optic disc is a yellow, orange to pink, creamy in color. It's oval in shape, about 3 or 4 milliliters, and I see the paired artery and one vein. Okay, are you okay? Okay, so now I'm gonna do your left eye. Okay, so I see the red reflex, orange glow from the refractory light from my ophthalmoscope. I see the optic disc nasally towards the retina. It's creamy, orange to yellow pink in color, oval shape, 3 to 4 centimeters, and I see a paired artery and one vein to all quadrants. Okay, so bilaterally, I see red reflex is intact. Your optic disc is a creamy orange to pink yellow in color. It's oval in shape, about 3 to 4 millimeters in size, and I see a paired artery and a vein to all quadrants. Okay, so that, I'm sorry, I'm gonna put this back. Okay, and grab my otoscope. Okay, so that concludes our eye exam. Okay, next we're going to move to our ear exam. Just hold it for me if you can. Don't touch this piece because this should be clean. It's gonna go inside your ear in a couple of minutes, okay? So for your for your ear, I'm just checking the pinna for symmetrical. There's no deformities. It's spaced from your head and your ears. Placement symmetrical. Okay. I'm also checking your auricles, anterior and posterior. Okay, I'm checking both of them. There's no lesions. Okay, and I'm checking for any displacement. There isn't any. It's symmetrical. You have symmetrical ear placement, okay, which is normal. I'm also checking for your mastoid process. It's behind your ear. Let me know you have any tenderness with this, okay? Tenderness? Tenderness? No. Okay. So now what I'm going to do is I'm going to check for your external ear canal. I'm looking for any lesions, drainage, or cerumen, which is wax. I don't see any. Okay. I'm going to do the same here. I don't see any lesions, drainage, or cerumen, okay? So now what I'm going to do is I'm going to actually look inside your ear, okay? Doing your right ear first. I'm going to pull your pinna up and down, okay? And I'm going to kind of light in here, okay? Okay, so I'm looking at your tympanic membrane, pearly gray, it's translucent, oval shape, it's mobile, and I see the landmarks, the incus, malleus, and stapes, and the corner light is on your at 5 o'clock, okay? Okay, so I'm doing your left ear. I'm going to, this is a clean piece, okay? I'm putting your peanut back, down, okay? Tympanic membrane, pearly gray, translucent, oval shape, mobile. Landmarks are intact, stapes, the incus, malleus, and stapes. And corner light is at 7 o'clock, okay? Any pain or tenderness with that? No. Okay, so bilaterally, your tympanic membrane is not, there's no perfusions, okay, which means tears. Okay, it's intact, and no lesions noted, okay? So I'm gonna put this here. I'm going to check cranial nerve number 8, which is your acoustic nerve, with the whisper test, okay? Also, we'll be performing a Weber's test and a Rhines test, okay? Explain those when the time comes. For the whisper test, I'm going to whisper one syllable word in each ear separately, and, and then you're going to repeat that word once you hear it, okay? Can you occlude your left ear, please? Yellow. Okay. Can you occlude your right ear? Okay, good. Okay, so now the Weber's test. I'm going to get my tuning fork, okay? Okay, so this is an instrument. I'm going to put this in the palm of my hand so I can make it vibrate. I'm going to put it in the midline of your skull, which is the top of the head, just like this. And then I'm going to ask you if you can hear the tone the same level in both ears or in one ear better than the other, okay? Okay. Can you hear it in the same in both ears or better in one ear than the other? No, I can hear same in both ears. Oh, okay, good. That's a normal uh high. Now I'm gonna do the Rhines test. This is a two-test procedure. I'm gonna put the stem of this tuning fork on your ear, on your mastoid process like this, and then when you don't, let me know when the noise stops. You can't hear it any longer, and then I will move it this way. Okay? Okay, ready? Stop. Stop. Okay. So where would you say you heard it longer? And behind your ear or next to your ear? Next to my ear. Okay, and that's a normal response. You're good. That's very, very good, okay? So that concludes our ear exam. Now moving on to your nose. I'm just gonna palpate the structure of your nose, checking for any tenderness. Any tenderness with that? No. So it's I don't feel any deviations. So now I'm actually gonna look inside your nose, okay? I'm gonna get my instrument. So this is a clean piece, okay? So You just lift your head up a little bit. Let me know if you have any discomfort so I can stop. Okay, starting with your right nose, nostril. Okay, so I'm looking at the septum. No deviation, no perforations, no lesions. The mucosa is pink and moist. Turbinates is pink. Um, n- no lesions and no drainage. Okay, now I'm gonna change this to the clean one. I'm sorry, I have to get another one. Doesn't work. Okay, clean piece. Checking your left nostril. Okay, so septum is pink. Um, no deviation or preparation. Mucosa is pink and moist. Turbinates are pink. No lesions and no drainage. Okay. So now put this back. Can you cover your eyes for me, please? So I'm going to test nerve number one, your olfactory nerve. I want you to smell something and let me know. Smell it, and then I'm gonna ask you what it is. Okay? Don't ask me until I ask you. Okay. Okay. You can open your eyes. And what was it that you smelled?
I think it was peppermint candy.
It is peppermint candy, as you can see. Peppermint candy. You can see you passed the test. Good job. Peppermint candy. Okay. So now I'm going to do your sinuses. Let me know if you have any tenderness with this, okay? Your frontal, any tenderness?
No.
I don't feel any fullness. Any your maxillary?
No.
I don't feel any fullness and there's no tenderness, correct? Okay. I'm moving on. That concludes our nose exam. I'm moving on to your mouth and pharynx, which just means your throat, okay? So for your mouth, looking for any lesions and dryness. There isn't any. Okay. So for the dental developmental exam, this is where I'm going to do it. Rest, the condition of your teeth. Remember? Okay. It's just a normal tongue bite, okay? So I'm going to. Can you open your mouth for me, please? Checking the condition of your teeth. No caries, no missing teeth in the upper lower. No missing teeth, no caries in the upper and lower right side. Okay, I see you have braces. Your buccal mucosa is pink and moist with no skin tears due to the braces, which is good. Okay, can you stick your tongue out for me, please? No coating, no papillation. You say ah.
Uh,
Okay, can you lift your tongue up for me, please? Your frenulum is intact. Your salivary glands are patent because I see some saliva there, and no lesions. Okay. Can you say again for me, please?
uh,
I see your. You put your tongue down. I see your tonsils are 2+. No exudate, no swelling, no redness. Your pharynx, which is the back of your throat, no exudate, no swelling, and no redness. Okay. And okay, your uvula rose midline. When you said ah, along with your soft palate, which is cranial nerve number 9 and 10, your glossopharyngeal, and your vagus nerve. So they're intact. When I ask you to protrude your tongue, it protrude when you ask you to stick your tongue out, it protrude midline, which is normal, and that's your cranial nerve number 12, your hypoglossal nerve. Okay. Um. So I believe that concludes our mouth exam. Any hoarseness back there in your throat? Okay, so soft and hard palate intact, no lesions. Um, gums, no, there's no signs of gingivitis. There's no redness, no bleeding, no lesions, and no swelling in your gums. Okay. Okay. And now we're gonna move on to our nose. These are just ring-shaped bumps that act as a filter. They kick germs out of your body when you're sick. Okay. So I'm gonna palpate for these, and I'm looking for any tenderness. Let me know if you have any enlargement of your lymph nodes, or if and I'm looking for mobility of them, which is a good thing. They have to be mobile, okay? So starting with your periauricular, postauricular, okay, tonsilary, submaxillary, submental, okay, um, moving your superficial cervical lymph node, your deep cervical lymph node, posterior lymph node, occipital lymph node, supraclavicular, infraclavicular, and I'm checking your elbows for your epitrachlear, epitrachlear. Any tenderness and pain with that?
No.
I will be checking your inguinal node, and I move on to the abdomen system, okay? And all your pulses were, all your lymph nodes were palpable. They were not enlarged and mobile, which is good. And there was no tenderness with them, right? No tenderness?
Yeah.
Okay. So now I'm moving on to your neck exam. So for your neck exam, when you put in your neck like this, I'm looking for the trachea, which is your one point, at its midline, and it is. Okay? You can put your neck normal now, position. Now with my hand, I'm just gonna palpate. I'm gonna palpate each side separately and noting for any enlargement, any tenderness, or any masses. And I'm measuring the distance between your trachea and the sternocleidomastoid muscles. So there's no enlargement, and I didn't feel any masses. Any tenderness with that?
No.
Okay. Now I'm gonna move on to your thyroid. An exam. I'm going to ask you. I'm gonna give you some water. I'm gonna ask you to drink some water, and I'm checking the thyroid, cricoid, and thyroid, cricoid cartilage, and thyroid gland, that they all move symmetrically midline when you drink the water. Okay. Moving on. Get my water. Okay. I'm going to be, so you can go ahead and take a sip and drink it. Okay, so your thyroid, cricoid cartilage, and your thyroid gland all move to mainline when you drink the water. Okay, so my next exam is going to be, what I want you to do is swallow some water. Take a sip of water, hold it in your mouth, and swallow it when I ask you to. Okay, I'm going to move around you behind your neck and palpate around your neck one at a time, and I'm checking for any enlargement or any masses. Okay, let me know if you have any tenderness. Okay, can you take a sip of water and hold it in your mouth? Okay, swallow it. Okay, now take another sip of water. Hold it in your mouth. Swallow it. Okay, so I didn't feel any tenderness or any masses. Are you okay?
Yes.
Okay. Okay. Now I'm gonna go and move on to your chest and thorax. Okay, I'm gonna assess your lung sounds. Okay. So what I'm gonna do is, right now I'm just measuring your anterior, posterior, and lateral diameter. Okay, so I'm gonna just check here. Anterior, posterior. Okay, so it's a 2-to-1, which is normal. Okay. There's no deformities in your chest. Okay. So now what I'm gonna do is I'm noting your respiratory effort. I don't see any supraclavicular or intercostal or use of accessory muscles to breathe, which is okay, which is normal. So now I'm going to percuss your back. I'm going to percuss, and I'm just looking for resonance throughout your chest. Okay, I'm just gonna tap your back. Okay, let me know if you have any tenderness with it. Okay, so resonance throughout your sounds. Now what I want you to do is I'm going to ask you to I'm gonna do a tactile fremitus, which is I'm going to ask you to say 99. I'm going to pat your back with the palmer side of my fingers, and I just want you to say 99 every time that you feel me move my hands around your lung sounds. Okay? Okay, say 99.
99, 99, 99, 99, 99.
Okay. I would explain the results later. Okay? So now I want to do a respiratory excursion. So I want you to breathe in and out and then hold your breath. I'm going to percuss again, okay? And then I'm going to uh, note where I hear the tonus, which is the location of your diaphragm, okay? Okay. Can you breathe in and breathe out and hold your breath? Okay, you can breathe now. So I marked it here. Okay, now I want you to take normal breaths, breathe in and out, and hold your breath again, okay? You ready? Go for it. Breathe in and out. Okay, so I will mark it here. So the distance is it's about a 3 or 4, which is normal because it should be between 3 to 5 centimeters, which is normal, okay? I'm going to do some voice test. I'm going to ask you to say digophony, E, every time that you feel me use this stethoscope on your lung sounds, on your back, okay? Okay, go for it.
E, 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 E.
Okay. So in a real life scenario, it'll be a little bit slower, but because of the time constraint, I have to do it a little bit faster, okay? So now we're gonna do bronchotomy. So you're gonna say 99, okay? In the same ladder pattern fashion, okay? And feel it on your back. 99.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay. So now you're gonna whisper in a low tone voice for 99 again, okay? And that's whispered retro low key. That's what it's called, okay? Okay. So those three tests are assessing for consolidation in your lungs, which means fluid in your lungs, which is abnormal. You should only have air in your lungs, okay? So now I'm gonna actually auscultate for your breath sounds anteriorly and posteriorly, okay? Starting with your back, which is your posterior side. And remember, it's got a time constraint. I'm just gonna a little bit faster than usual. So I'll be checking for a complete inhale and exhale in a real life scenario, okay? Now here. Okay, so your breath sounds are vesicular throughout, which is normal. There is no adventitious breath sounds, which means abnormal breath sounds. You don't have any. So breath sounds clear, vesicular throughout, and no adventitious breath sounds anteriorly, posteriorly, and bilaterally. Okay, because you have two sets of lungs. Okay. Okay. So that concludes our lung exam. Okay. And I'm going to move on to the heart exam. So for your heart, first I'm just looking for any heaves or lifts, which will mean an enlarged heart. Okay, so I don't see any. I'm going to actually palpate for any arterials with my hands. Okay, for aortic, which is on your right second intercostal space, pulmonic left intercostal space, tricuspid in your lower left sternal border, and your mitral is in your fourth to fifth intercostal space, mid clavicular line. Okay, I didn't feel any thrills with that. So now that I'm here, I'm going to check your point of maximal impulse. Which in a real life scenario, I would go under your shirt. I'll pay for it for 1 minute. So I'll just pretend this is under your shirt. Again, in your between your fourth or fifth intercostal space, mid clavicular line. I will check for a minute, and it should be at least for your age group about 85 is good. Okay, so we're gonna say that's what it was. Okay. Now I'm going to auscultate your heart sounds, okay? I'm listening to the lub of your heart, which is S1 and S2. I'm gonna listen to it with the diaphragm of my stethoscope. Okay? Just breathe normally, okay? Again, aortic, pulmonic, tricuspid, mitral, okay? So normal heart sounds heard, S1 and S2. Now I'm gonna check for abnormal heart sounds, which are S3 and S4, which are extra heart sounds that shouldn't be there, with the Elamite stethoscope, okay? I'm gonna go backwards this time. Mitral, tricuspid, pulmonic, and aortic. Good. No S3 and S4 heart sounds noted, which is good. No murmurs. To accentuate a murmur sound, I'm going to ask you just to kind of lean to your left side, okay? I'm going to be listening to mitral murmurs with the stethoscope, okay? Okay, none heard. Okay, so now I want you to lean forward, and I'm going to be auscultating for aortic murmurs, okay? With my diaphragm. And I'm sorry, I want you to breathe in and hold your breath, okay? Breathe in and hold your breath. Okay, so no murmurs heard, okay? So now we're gonna be moving on to our um um our peripheral vascular system. I'm gonna check your pulses, okay? About your body, okay? So first I'm checking your temporal, okay? Your radial, your ulnar, okay? Your popliteal, which is under your knees, okay? And I'm going to be checking for your posterior tibialis, which is uh, behind your ankles, okay? I'm doing this here and here. And then I'm checking for your dorsalis pedis, which is on top of your feet. And while I'm down there, I'm going to check for edema and palpate for edema, okay? So palpating for dorsalis pedis and edema. There is none. So when I move on to the abdomen, I'm going to be checking your femoral pulse and your inguinal lymph node, okay? So your pulses throughout your body are 2 plus, which is normal and regular rhythm, okay? Okay, so that concludes our peripheral vascular exam. Now we're going to move on to our abdomen exam, okay? So you can lay down on the table. I would have to going to move the camera accordingly so our professor can see us, okay?
Would you like me to take my shoes off?
Yes. Take your shoes off. Okay. Okay, so maybe if you can turn this way, your head towards the side, so she can see that your head this way. There you go. This way. Long ways. Awesome. It's gonna show your abdomen. Okay, so in a real life scenario, I would expose your abdomen, but I'm not for privacy matters because you're 12 years old. Okay. So I'm looking at the contour of your abdomen, pretending that your shirt is lifted. No scars, no lesions, no pulsations, no discolorations on your umbilicus or around your umbilicus, which is your belly button. I don't see any pulsations, which is good. Okay, now I'm going to auscultate in your 4 quadrants, which is your right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay, and I'm auscultating for normal active bowel sounds, which I should hear at least 5 to 30 bowel sounds in 1 minute in each quadrant. But we don't have time, so I'm just gonna tap where I should be hearing for that. Okay. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Normal reactive bowel sounds, 5 to 30 bowel movements in 1 minute. I'm also checking your aorta for any bruits and your renal arteries for any bruits with the bell of my stethoscope, okay? You don't have any? And I use the bell because this helps me catch softer, low-pitched sounds, okay? Okay, so now I'm going to percuss in those 4 quadrants, okay? Remember, it's just, I'm going to tap my own with my own fingers, okay? Let me know if you have any tenderness with this, okay? Right lower, right upper, right, left upper, left lower. Any tenderness with that?
No.
Okay, so what I felt was tympani, just normal. It's air in your abdomen, okay? So now I'm going to percuss for your liver span, okay? So I'm gonna come this side, okay? I'm gonna just reach over you, okay? Starting with your right lower quadrant. So normally I would get a pin and write on it because I'm gonna have to measure that space, okay? Now from your nipple line going down, I'm gonna percuss, okay? Okay, so I will mark the spot. I will measure with this ruler. About a 6, which is normal. It should be 6 to 12 centimeters. It's normal, okay? So now I'm gonna do some special maneuvers, and this is to elicit let me know if you have any peritonitis, which is inflammation of your lining of your diaphragm, or any appendicitis, which is inflammation of your appendix. Okay. So what I'm gonna do is I'm gonna just press firmly here in your right lower quadrant. Is any pain with that?
No.
Okay, so that's your rebound tenderness. You don't have any, which is normal. I'm also gonna check for the roving sign. I'm going to palpate on your left lower quadrant. Did you have any pain on your right lower quadrant?
No.
Which is normal. That's good. And then I'm also going to check. I'm gonna go now. If you can move this way with your head towards this way, your leg towards that way. I'm going to do the psoas sign. You lift your right leg against my resistance. Lift it up. Any pain on your right lower quadrant?
No.
Okay. So now I'm gonna do the obturator sign. Okay. I'm just gonna flex your knee and your hip and internally rotate your leg. Any pain on your right lower quadrant?
No.
Okay, all that is good, okay? That means that you have no appendicitis, no peritonitis. So you can stand up for me, please, and hang your legs this way. Okay, I'm going to check for the CDA tenderness. Just gonna hit my own hand, okay? Let me know if you have any tenderness with it. Tenderness with that? Okay. So, I'm sorry, can I lay you back down?
Yes.
So, I'm going to check your femoral pulse. Regular 2 plus. Okay. Now your inguinal lymph nodes. Remember the V-shaped pumps? Okay, mobile. And they're mobile. Any tenderness with that?
No.
They're not enlarged. Okay. So now that I have you in this position, we're gonna move on to our musculoskeletal system. I'm gonna check your greater trochanter, okay? Any pain and tenderness with this?
No.
Okay. And I'm gonna deeply palpate, moving back to our abdomen. And I'm gonna palpate, okay? And palpating for any tenderness or masses. Any tenderness with that?
No.
Now I'm deeply palpating. Your kidney, your spleen is inflamed, your flanks. Any pain or tenderness with that?
No.
Okay, so moving back to our musculoskeletal, no tenderness with your greater trochanter, correct? So for your musculoskeletal, I'm doing your upper and lower. I'm going to identify the landmarks of your bones, and I'm going to do range of motions, okay? And I will show you. If you don't understand, it's okay. Let me know, and I'll repeat it or show you myself, okay? So starting with abduction, away from your body, adduction, towards your body, flexion. You playing with that?
No.
Okay, so you can just slide this way. Just move your body this way. So for extension, I'm gonna drop your leg. You pain with that?
No.
Okay, so for I'm gonna do again, flex your knee, your hip, internal rotation, external rotation. Any pain with that?
No.
Okay. And you can stand up. You can sit down for me, please. Okay, so now I'm going to do your check your temporomandibular joint. Just open and close your mouth. Okay, good. You need tenderness with that?
No.
Okay. So just let me know if you have any tenderness when I'm doing the range of motions, when you're doing the range of motion, or when I'm palpating, okay? So I'm doing your cervical spine, your vertebrae spine muscles, or any tenderness? Any tenderness with that?
No.
Okay. So now for your range of motions for your neck, I want you to flex this way and look up at the ceiling. So your shoulder to your ear to your shoulder, lateral bending, and now look over your shoulders. Okay, any pain with that?
No.
Okay, good. So now I'm going to move on to your shoulders. I'm checking your acromioclavicular, your occipital groove, bicipital groove. Any pain with that?
No.
Your glenohumeral joints. Glenohumeral joints. Okay. So now what I want you to do is just for flexion, extend your arm 80 degrees, 190 degrees, and for extension, backwards. Awesome. Okay. So for internal rotation, I want you to go behind like this. Reach out for your scapula or your shoulder blade. Good. Okay, for external rotation, just pick your arm out, bend your elbow, pick it up this way. Awesome. Okay. And I will be doing this both left and right side. But for today, I'm just gonna do one side, okay? Okay, so for abduction, if you can just kind of look towards the camera, if you can. For abduction, I want you to just abduct your arm this way. Awesome. Across your chest for abduction. Okay, so now that is your shoulder is normal. We're gonna move on to your elbow. I'm checking your ocrine process, your humeral epicondyles. Any tenderness with that?
No.
Okay, that's good. Okay, so just flex. Okay, extend. Pronation, supination. Awesome, you did good. Okay, so now I'm gonna do your wrist. So for your wrist, I'm checking your carpal bones, your ulnar and your your radial and ulnar styloid. Any pain with that?
No.
Okay. So for your wrist, I just want you to flex. Now towards the ceiling. Okay, good. Okay. I'm going to your hand. Okay, your hand. Checking your metacarpals. Any pain or tenderness with that?
No.
Okay. Metrocarpophalangeal joints. Any tenderness with that?
No.
Okay, your proximal interphalangeal joints and your distal interphalangeal joints. Any pain with that?
No.
Okay, so for your hand, I want you to make a fist. Bring them normal. Now spread your fingers for abduction. Bring them together for abduction. Now we're gonna do our fingers. Okay, and kind of towards the. Okay, so we're going to adduct, extension, flexion, extension, opposition. Each finger. Awesome. Okay, so any pain with those? Okay, so that concludes our musculoskeletal from your upper extremities. Now we're moving to your bottom, okay? So we're gonna do your knees. Okay, can you kind of sit this way? Okay, so I'm going to let me see, okay, so I'm going to your femoral condyles, okay, your lateral and medial joint spaces, okay, and your tibial tuberosities. Any pain or
No.
tenderness with that? Okay, so your knee is already in a flex position, but I'm just going to flex them a little bit more like this, okay, and just extend your leg upwards. There you go. Okay, so now moving to your ankle. Okay, so for your ankle, I'm assessing your lateral and medial malleolus. Okay, on both feet. Okay, so for your can you scoot back? Okay, so can you point your toes to the ceiling? Okay, now there you go. Okay, can you bring your heels inward? Okay. Can you spread your legs a little bit more? Like that. Bring them inwards. Or inversion. Bring them outwards. Or eversion. Okay. Perfect. Any pain or tenderness with that? Okay. So now I'm going to do your toes, your feet. So torso, your tarso joints, your metatarsophalangeal joints. Any pain with that?
No.
Okay. Your proximal metatarsal joints. Okay. And your distal metatarsal joints. Any pain with that?
No.
Okay. For your toes, range of motion, just all your toes. Awesome. Let them go. Okay. Can you spread your toes at the put them back to normal? Okay. So that's your toes. Now I'm going to do your spine. Can you stand up for me, please? Look at this way so she can see you. So for your spine, I'm looking at your um thoracic spine, in I'm sorry, your vertebrae, your paravertebrae muscles. Any pain with that?
No.
Checking for your sciatic notch. Any pain with that?
No.
Okay, so in a real life scenario for your age group, I would you would have a gown that would expose your back. So we're gonna pretend that you have that. I am going to tell you to for flexion and to check for kyphosis, lordosis, and scoliosis. Can you lean forward to touch your toes and stay like that for a minute? So for your age group, I will be assessing your scapula, your rib, and your spine for any swaying. Okay, for scoliosis, you don't have any. Okay, you can stand up for me. Okay, you can look this way, please, towards the camera. So your kyphosis is just you have regular outward curvature of your spine. Your dorsus is regular inward curvature of your spine. It's regular. You have no scoliosis. Okay, everything is your spine is symmetrical and no deviations. Okay, so for your range of motion for your spine, can you already did flexion when you touched your toes. Now let's do look at the ceiling. Okay. Now lateral bending to the sides like that. There you go. Okay. And then for rotation this way like that. I'm sorry, there's no room in this house. Okay. Um. Okay. So that concludes our musculoskeletal exam. Okay, so now we're moving on to our neurological exam. I'm gonna do the cranial nerve. You can sit down here. Sit down. Okay, we'll do the cranial nerve. So there was some that I already assessed. Your cranial nerve number 1, which is your olfactory with the peppermint candy. Optic nerve number 2, I already assessed with your visual fields and visual acuity. Okay, cranial nerve number 3, 4, and 6, I already assessed, which was your oculomotor, your tricular, and your abducens with your extraocular movements. There was no lateral deviations, and your pupils responded to direct and consensual lighting accommodation. Okay, so we're gonna do number 7. I have not done. It's called your trigeminal cranial nerve. I'm going to grab a cotton ball with your eyes closed. I just want you to tell me when you feel the cotton ball on your face. Okay, I'm gonna be touching 3 different sections of your face alone. Okay, so let me know. Feel it?
Feel it. Feel it. Feel it.
Okay, so for the motor part of your trigeminal, I'm going to ask you to bite down on this. I'm going to tug on it, but don't let it go. I'm massaging your masseter muscle, okay? Let it go. Okay, let it go. Perfect. Okay, so for cranial number 8 is your facial nerve. Can you smile for me? Can you show me your teeth? Can you wrinkle your forehead? Can you puff out your cheeks? Can you make a frown for me? Perfect. Okay, so for cranial nerve number 9 and 10, your glossopharyngeal joint, cranial nerve, and your vagus, we assess that when I ask you to stick out, when I ask you to say and your uvula and your jaw palate rose midline, okay? So cranial nerve number 9, your spinal accessory, I have not assessed. So I'm going to ask you to I'm going to put my hands on your chin and just look to your left, look to your right against my resistance, okay? Ready? Go for it. Your left, your right, okay? Now, Now your shoulders, I just want you to shrug your shoulders, distance on my hands. Can you do that for me? Awesome. Okay, so that's intact. Okay, so now I'm gonna do cranial nerve number 12, your hypoglossal nerve. We did that when I asked you to stick out your tongue and it protruded midline, which is normal. Okay, so now I have to do the tendon reflexes. I'm gonna grab my hammer. Okay. Okay, ready? So I'm gonna do your biceps. Okay, your biceps. Okay, your brachioradialis. Okay. Now I'm gonna do your knee, which is your patellar. Okay, just let it hang. Okay. I'm gonna do your Achilles. I'm gonna dorsiflex your feet and hit with the hammer behind your ankle. Okay, that's good. Now I'm going to, if you can lay back on the table for me, please. I'm gonna check for Babinski. So I'm just gonna take this and I'm gonna move it around the soles of your feet. Okay. Okay. Let me see. Hold on. The backwards J. Okay, so it's negative. I didn't see your toes didn't fan out, or which is normal. Okay. Um. Okay, so now you can sit up, please. Okay. So your reflexes are normal. Okay. And now what I'm going to do, after your reflex, I'm gonna do. I will not be doing your infant reflexes because obviously you're past infancy. Okay, but I will name them for you. For that would be your tonic neck reflex, your motor reflex, your stepping and placing reflex, your palmar and plantar grasp reflex. I would have checked your um uh, clinical curvature. Um, and the one that we still have is our parachute reflex that remains with us throughout our life. And that's just a protective response. So if anybody pushes you or you're about to fall, automatically your reflexes are to put your hands in front of you, okay, to stop the fall. So you're going to have that throughout your life, okay? So now what I'm going to do is I'm going to ask you to stand up. I'm going to ask you to walk that way, then stop, and then come back and heel to toe walk for me, okay?
Okay.
Go for it. I'm looking at your walk. It's effortless and rhythmic, okay? Heel to toe. You're able to keep your balance, okay? All right. So now I'm going to check your um, muscle strength. Can you sit down? Okay, so put your arms like this with resistance, okay? Let me pull them down. Okay, push them outwards. Okay, push them outward. Okay, push them inwards. All right. Now the same with your lower extremities. Push them up. All right, against my resistance. Push them down against my resistance. Your feet. Push them up against my resistance. All right. Push them down against my resistance. All right. Okay. So there are 0 to 5 is a grading scale for your strength. It's a 5, which is normal. Okay. Okay. So now what I'm going to do is um I'm going to do the sensory part. So I'm gonna grab the cotton again. This time do your upper and lower extremities, okay? And I'm gonna do with the soft and then with the sharp object. I'm not trying to trick you. I just want you to tell me when you feel it, okay? The cotton. Close your eyes.
Feel it. Feel it. Feel it. Feel it. Feel it.
Okay, good. So now sharp.
Feel it. Feel it. Feel it. Feel it. Feel it. Feel it.
Okay, so you felt that. Now your vibratory sense. Put your hands out for me like this. I'm gonna do it in your index fingers and in your great toes, okay? Let me know when you feel it and when you stop feeling it.
Feel it. Stop. Feel it. Stop. Feel it. Stop. Feel it. Stop.
All right. Now your vibratory sense. Put your hand out like this. Close your eyes. Let me know if I'm moving your finger up or down. Down, up, up, down, up, down, up, down. Okay. So now we're gonna do is if you can stand up, and I'm gonna do the Romberg's test and your pronator drift. So close your eyes, feet together, and put your arms up like this. Pronation, close your eyes. So I'm checking for any swaying of your body, somewhat is normal. I'm checking for your arms not to fall down or do a pronator drift, okay, which is palms down. Okay, open your eyes. You can sit down. You passed that test. So now I'm going to do the alternating movements. Okay, so you can just do this really fast. Awesome. Okay, for your feet, the ball of my hand, with the ball of your feet, just hit my feet, my hand like that. Okay, ready? Okay, now with the other one. Oh, awesome. Okay, so now I'm going to do is uh point to point uh, a test. So what I want you to do is point your nose with your finger, and then point to my finger, and I'm going to be moving this. So you have to do it. Try not to miss my finger. Okay. So touch my finger and then your nose. Okay. So good. This concludes your head to toe physical exam. Okay. Thank you very much. You did an awesome job.